I want to thank you for joining us today. My name is Hillary Ritt, and I am the Workforce and Adult Services Librarian at the Kentucky Department for Libraries and Archives. I'm pleased to have with us today Dr. Beth Waller. She's going to present today on library patrons, psychosocial needs, how social work collaborations could help in Kentucky's public libraries. And Dr. Waller, is the director of the School of Social Work at the University of North Carolina, Charlotte. She's also the founder of Beth Waller Consulting. And without further ado, I'm going to stop sharing my screen and share her slides. And I'll also put some information about captioning in the chat. But I'm going to let Dr. Waller start her presentation. So we're so thankful to have her here today, and look forward to her presentation.
Great, thank you, Hillary. Can you hear me?
Yes.
Okay, wonderful. So I'm really happy to have the opportunity to talk with all of you today about this topic. It's certainly a hot topic in both the library world and the social work world right now. Really talking about some of the issues that public libraries are facing and ways that social work collaborations can help with those issues. Hillary, I am not seeing the slides. Okay, now they're there. Thank you. So a little bit about me and why I'm here to talk about this topic first. And I'll also let you know that I'll talk for really probably like 45, 50 minutes. And then at the end, there will be time for questions if anybody has questions, or if you type them in the chat, I'll try to keep an eye on them as we go through the presentation. But a little bit about me and why I'm talking about this topic today. So I am a social worker by training. I have about 14 years of experience working with people primarily who had poverty-related challenges or things that were either that were barriers to their economic stability and their economic mobility. So those were things like mental health problems, substance use disorders, intimate partner violence, all kinds of things that were barriers to them moving forward in their life with their goals. And I'm actually really thrilled to be here today because all of my experience is in the state of Kentucky. I was born and raised in Kentucky, worked a large part of that practice experience I mentioned was for a statewide program that was run through the University of Kentucky. So I used to have to drive around the state and work with different agencies and organizations around the state, as far west as McCracken County, and then all the way over in the east in Pike County, and then kind of everywhere in between. So I'm thrilled to talk about this with all of you there in Kentucky. So after my practice experience, I got my master's in social work and then eventually my PhD in social work from the University of Kentucky. I then moved into a full-time academic role, and I moved across the river to Indiana first. And I always joke that my family, who are diehard UK basketball fans, were more upset about me working for Indiana University than they were about the fact that I actually moved away. So they felt like that was a personal betrayal that I was working for IU. But I started my academic career as a faculty member at Indiana University in the School of Social Work, and then moved into administrative roles. And I'm currently the director of the School of Social Work at the University of North Carolina at Charlotte, as Hillary said. It was at Indiana University that I actually fell into library social work by accident. And I always say it's a happy accident for me. I was in Indianapolis at the time and was approached by the public library there asking for social work students because they were experiencing a lot of issues with people experiencing homelessness in their downtown central branch of the library. They were having a lot of issues with substance use in the library, severe mental health crises that were happening, and just general issues with people who were asking the library staff for connections to resources and help with things that they didn't feel trained or prepared to help with. So they asked for some social work students. We actually asked to do a needs assessment with them first before placing students there, so that we really understood what the setting was like that we were going to be putting students into and what their primary goals would be. And with Indianapolis, we wound up piloting some social work placements and then continuing to gather data where they have eventually been able to hire a full-time social worker that they hired last year. But it was through that work that I worked with the Indianapolis Public Library administrators to publish and present on what we were doing in Indianapolis. And at that point, libraries started coming out of the woodwork from all across the country. So for quite a few years now, my primary focus for my own research has been working with public libraries to really understand patron needs that are happening in libraries, staff needs with those kinds of patron issues that I mentioned earlier, and then ways that either we can collaborate or that we can help libraries sort of boost their capacity to address the kinds of issues that are happening in their spaces now. And then I opened up a consulting business that Hillary also mentioned called Beth Weller Consulting, where my work is with individual libraries of all sizes to do things like needs assessments, program evaluation, program design, training, those kinds of things. And I work with libraries big and small across the country, some statewide library associations, some large systems, and some really small rural libraries. So I've got, it's become my primary focus to my work at this point in my career. So I'm going to use the term psychosocial needs throughout this presentation. And by psychosocial needs, I mean really any psychological or social or environmental factor that's associated with chronic stress or strain or poor health outcomes in general populations. So these include things like substance use problems, social isolation and loneliness, mental health problems, and poverty-related needs like housing insecurity, food insecurity, things like that. So in the presentation today, I am going to focus on recent research about how public libraries' roles have changed due to these changing patron needs, some common psychosocial needs that we are seeing in library patrons, and then how social work partnerships are used to complement library services to address these kinds of needs. So there have been a number of historical changes that have really impacted libraries over the past couple of decades, really, and have led to this shift that we're seeing now. The first one was the deinstitutionalization movement, which happened back in the 60s. And this was a movement, so before this time, anybody that was perceived to experience some sort of mental health problem or mental illness was often hospitalized and kept in a psychiatric hospital for very long periods of time, sometimes their entire life. And leading up to the 60s, we had learned at that point that being institutionalized for most of somebody's life does not help them in any way. And in fact, it causes other problems because they're isolated from their social support networks. They're kept from having any way to feel productive or feel like they're, giving back to society in any way. And those kinds of things really impact somebody's well-being. So in the 60s, there was a movement to get most of the people who were in psychiatric institutions out into the community, back with their families, back with their social networks, and just living in the community. And there were federal resources that were put into developing community mental health centers and resources in different communities around the country. The issue that happened at that time, though, is that the resources have never kept up with the need. And in some communities, there just aren't resources. And so people with chronic mental illnesses are often, found in situations where they can't maintain a adequate standard of living. Like they can't support themselves, they can't maintain housing. They may not be able to access medical care, get medications they need, get to therapy or things like that. So that's led to a huge increase in homelessness that we've seen across the US, and specifically homelessness for people with chronic and persistent mental illnesses. In addition to that, the Great Recession and the mortgage crisis that happened in the late 2000s, like 2007, 2009, brought an increase across the country in people who are experiencing challenges related to poverty. At the same time, we have a shortage, and we continue to usually have reduced numbers of emergency shelter beds, so we don't have enough even emergency shelter for people that need it. We've had increasing costs across the country that all of us have experienced with stagnant wages. So, for example, the minimum wage has been $7.25 an hour since 2009, but the estimated current living wage for somebody living in Kentucky, and this is for a single adult with no dependents, no children, is twice that, 1546 for one person. If they have one child, that living wage goes up to 30, 32 an hour. If they have two children or dependents, then they really need to make 38, 31 an hour to be able to pay for all of their basic needs and necessities. There also have been increasing municipal statutes across the country that criminalize homelessness or things associated with homelessness. So many cities have passed regulations that prevent people from camping in public sites, sleeping on the street, panhandling, or asking for money. Those kinds of regulations push people experiencing homelessness to indoor places where they can go, which, the public library is one of the most common ones. And then the COVID pandemic, of course, has led to increased poverty, poverty-related challenges across the country, increased food insecurity, housing insecurity. Mental health challenges have increased with the pandemic. We've seen increases in intimate partner violence, substance use, all of those kinds of related issues. So these impact the general public and impact who is walking in the doors of public libraries across our country. In Kentucky specifically, we see a number of factors that are impacting people in that state, and those are things like difficulty accessing health care, lack of access to mental health care, housing insecurity and homelessness, and poverty. So if you look at this map of Kentucky, this is showing which counties in Kentucky are designated by the federal government as healthcare shortage areas. So the darkest counties are counties where the whole county is deemed to be a healthcare shortage area, and there aren't enough healthcare providers for the people that live in that county. The kind of medium shade of blue are counties where part of the county is considered a shortage area, but not the entire county. And then the lightest blue, those are the only counties that are not healthcare shortage areas in the state of Kentucky. So it really is most of the state that does not have enough healthcare for people that need it and want to access it. Now, this map shows mental health shortage areas. Again, this is a designation from the federal government that shows counties where there are not enough mental health providers for the people who live in those counties. And the entire state of Kentucky is a shortage area for mental health care providers. So even when you have people who want mental health care, who might have financial resources to get mental health care, if it's not around them or not in their county, they may not be able to access it anyway. Housing is also a problem in Kentucky. The annual point in time estimate, which is a count that happens once a year of people experiencing homelessness, in 2020, which is the most recent count, found an estimated 4,011 individuals who are homeless on any given night in the state. These point in time estimates are widely considered to be large underestimates of the actual number of people experiencing homelessness because they can't capture everybody across the state. Nearly 19,000 children in Kentucky public schools experienced homelessness during the 2020 and 2021 school year. There's also a shortage of rental homes that are affordable around the state for low-income households, and Kentucky needs about 80,000 more affordable rental homes to actually meet the need in the state. And then of Kentucky residents who actually have housing, 30% of people who are renting in the state are considered extremely low income renters, which means they make less than $26,200 for a family of four. And 63% of those renters pay more than half of their income on housing. So even when they are in some sort of income-based housing, they're often paying so much for housing that means they can't pay for medicines, they can't pay for for food, they can't pay for transportation, other kinds of things that they and their families need. And then poverty is a big issue in Kentucky. And the statewide poverty rate is about 14.9% of the population in the state is at or below the federal poverty guideline. And you can see right there, the actual federal poverty guideline is that a family of four makes $26,500 or less a year. And if you think back to what I said earlier about the living wage, there is a huge gap between who technically doesn't fall below this poverty guideline and they're not counted in this rate, but they don't make enough to really meet all of their needs or pay all of their expenses for themselves and their family. So even when we're looking at this, the numbers of people who fall below this rate, who really are living in extreme poverty, You can see from this map, the darkest counties are the ones that have the highest poverty rate. So while the whole state has a 14.9% poverty rate, some of the poorest counties in the state have poverty rates going up over 66% of the population in that county. So all of those things impact the communities that a library is in and the people who are coming in the library and the kinds of things they're going to ask the library for help with, or the kinds of things that they're going to the symptoms they'll experience, or things that you might see or observe in the library space. And there's been a growing body of research over the last decade or so looking at psychosocial needs of public library patrons around the country. And we've seen that these needs have been increasing, and the top areas of patron need tend to be homelessness or unsafe or unstable housing, mental health challenges, substance use or overdoses that are happening sometimes in the library space, and then poverty-related needs. These areas of need vary based on housing status, which makes sense. So somebody who lacks stable housing is more likely to have some of these other needs, so other poverty-related needs, mental health challenges, things like that. The needs are expected to continue increasing over the upcoming years because of the COVID pandemic and all of the fallout from the pandemic. And one thing to remember when you look at this information is that most of the current needs assessments that have been published are really from urban or suburban libraries, and we don't have a lot of information about urban libraries. There is a needs assessment that's going on right now that I'm actually doing in another state, where we're looking specifically at rural libraries versus urban libraries to really understand how the needs differ and how the needs of staff differ in those types of libraries. So I'm going to show you some data from some of my research that is looking specifically at the types of needs patrons self-report and the types of needs that staff report about the patrons that they're serving in their libraries. So this first table I'm getting ready to show you is data from needs assessments of patrons, where we ask them to self-identify the kinds of needs they had. The table I'll show you includes patrons from 3 different libraries in 2 different Midwestern states. And most of these patrons responded by surveys that popped up on the library computers or paper surveys that were in the library space. And then 2 of the 3 libraries also emailed out the survey to their patron listservs. And that's going to be important here in a minute. So these are from self-reported needs. And in this table, the libraries, so they're rated according to the USDA rural urban continuum code. So the lower numbers mean they're more urban areas. The higher numbers mean they're more rural areas. These actually, all 3 were in areas that were considered urban in some way. They're just different size urban communities. The library on the left is the one that only surveyed people who are actually using the library space, which is important because the percentages of people with these needs is higher. The other 2 libraries are the ones that surveyed people in their space, but also emailed it out to their listserv, which would include people that actually aren't even physically using the library space. So we see the percentages of needs being a little bit lower for those. The top 5 needs for these library patron groups are highlighted in yellow. The middle library has 6 highlighted because there actually was a tie for the 5th place. But you can look and see, even though these are in different communities and sometimes different states, the needs are very similar when we look at the top percentages, the highest rated needs. So financial needs made it in the top 5 for all 3 library samples. Medical and physical health needs made it in the top 5. Employment made it in the top 5. Then mental health and education and literacy made it in the top 5 for 2 of the 3 libraries here. And then transportation and clothing were top 5 needs for 1 library. And then social connections was a top 5 need for another library. So these are the patrons self-reporting about the needs that they have. The next table I'm going to show is from the staff, and it's going to look a little bit different. So this is when we ask staff to report what they're seeing as the highest needs of the patrons in their library. This is from 7 different libraries in 4 different states. 3 of these states are considered Midwestern, 1 state is considered Eastern. These were varying community sizes, some very large urban areas and some much smaller, more rural areas. And these needs assessments were done through electronic surveys that were emailed out to staff from these libraries. So again, the libraries on the left side are the largest, most urban areas, and the libraries on the right side are in smaller communities and smaller libraries. So the top 5 needs are highlighted again, unless there was a tie, which there is a library. The last one on the right had a tie again for 5th place, so there are 6 that are highlighted. So again, these are in different states, different libraries, very different communities. The one on the right is a relatively rural community. And then we've got a really large urban community on the far left side of the table. Even with those differences, we see similarities across the board with the kinds of needs that staff are reporting are the biggest ones for their patron population. So financial needs, mental health needs, appear for all 7 libraries in the top 5. Then we see housing and substance abuse and employment appearing in the top 5 for 6 out of the 7 libraries. And then we see 2 of them reporting medical and physical health needs, and then the one that is the more rural library reporting education and literacy, and then social connections being in the top 5 needs that their patrons had. So all of these changes and the high levels of need that patrons have in libraries is really causing a huge strain for library staff. And we know that, again, there's been a growing body of research looking at staff needs and what staff are experiencing in libraries. And we know that staff are reporting that they're not trained or qualified to assist with the levels of need that are often happening in their library. Staff sometimes feel conflicted about what their role is even supposed to be with these kinds of needs, or what the role of the library should be. Patrons with these kinds of needs often take more time for staff, which causes a lot of strain because staff are trying to meet the needs of all patrons, and they're stretched thin, or feel like they're neglecting some groups of patrons because of these high need patrons. Some staff fear for safety or the safety of their patrons because of these kinds of patron needs. And then some libraries have to frequently call police or for emergency assistance, and some libraries are adding on-site security because of these kinds of needs that they're experiencing. We also know from, there's some new research that's being done looking at rates of trauma that library staff are experiencing. And we see that frontline library workers, all types of libraries, suburban, urban, and rural, report high rates of trauma from workplace incidents with their patrons. They're reporting that they're experiencing verbal abuse, physical aggression and attacks, and threats of violence from patrons. These incidents have only increased since the COVID pandemic started. People are agitated, and it seems like there's a lot more violence and acting out that's been happening in our country. And then some library staff actually report experiencing symptoms of PTSD or experience worsening of a pre-existing mental health condition because of what they're experiencing in their library. During COVID, again, these needs really increased. So many libraries were shut down for a while, and then when they reopened, what has happened is that we see libraries often having less patron interaction overall, but the interaction they're having is more unpleasant than it used to be. So there was more effort trying to enforce COVID-related restrictions. Staff report that they were addressing more patron mental health problems, poverty-related needs, and other types of psychosocial needs. They were handling more patron-related behavioral issues that were happening in the space. And then there was an increased emphasis on virtual and remote programming and curbside services, and many of those things have stayed even as libraries have reopened. So when we look at these kinds of things, these are important because a lot of these are factors that predict burnout in the library workforce. So from literature on burnout, we know when people have less rewarding interactions and they're having much more stressful interactions, or their job has shifted in some way and they may not feel prepared for that change, then we see increased rates of burnout. And we are seeing that across the library world with people sometimes leaving library work altogether, or changing jobs or changing libraries because of some of what they're experiencing. So to try to address these needs, there has been a growing movement to partner social work services with public libraries across the US and Canada. It's also happening over in Australia, and now there are some other countries that have begun looking at this as a model they might use. There are lots of different models of social work collaborations with libraries, and I want to be very clear that when we see these collaborations, this is not saying that the library is becoming a social service organization in any way. It's just that they're trying to address kind of a different type of information needs that their patrons have through these social work collaborations. And they're really focusing on developing collections of relationships with community providers to try to meet these kinds of needs. It makes sense on a conceptual level for our professions to merge and partner with one another because we really have a lot of overlapping professional values. So both library work and social work really value service to the public and service to people. We value privacy and confidentiality, although how we do that looks a little different, which can cause some issues sometimes with the collaborations, and there are some things that have to be worked out. But we value privacy and confidentiality of the people seeking our services. We value increasing access to accurate information and fighting against some of the disinformation that's happening right now in our society. We value respecting people's rights and their individual rights and community rights. We value professionalism and upholding our professional values and integrity and honesty and social justice. One place where we really complement one another is that for library workers, your focus is on the whole public. Your role is to serve the whole public. For social workers, our professional mission is really to focus on people who are considered to be the most vulnerable or the oppressed in any sort of circumstance. This is a way we really complement one another, because when you have a social worker in a library, that social worker can really focus on those high needs patrons, which frees up some of the energy and time for library workers to really focus on addressing the needs of the whole public. So some libraries are trying to address the social service related needs of their patron populations through trained librarians or trained library staff, and that's certainly possible. But there are some advantages that libraries are seeing when they use a social worker in any kind of format, and it has to do with the way social workers are trained. So all social workers are trained. We might specialize in certain areas later, but all of us are trained, and it's actually a requirement of our educational programs that we train people to work across what we call the micro to macro continuum of services and in a generalist environment. So by micro, I mean working with individuals or families. But it's those people skills, the working with people, assessing them or assessing their needs, helping to connect them with resources, using clinical skills, even if we're not doing therapy, to try to help people sort of move forward towards their goals. And then by macro, I mean the community or the organizational level. So we're also trained to assess organizations or assess communities and to look for gaps in services and how we can address those things on a larger level. And then we're also trained for generalist environments, and a library is a perfect example of a generalist environment, because that means it's not a specialized environment, and it's a place where people of all ages, from all different populations, and with all different kinds of issues and challenges go. So that's a generalist environment. So all bachelor's in social work programs and all masters of social work programs have to prepare people for all of these kinds of things. And then some master's programs do have specialties on top of that. So sometimes people think of clinical social workers that do therapy. Sometimes people think of child welfare workers, substance abuse therapists, school social workers, medical social workers. So those are those advanced practice areas that sometimes people go on and get specialized training in, but we're all trained to be generalist social workers. Social workers are also trained to look for the root cause of a problem. So rather than just looking at what somebody's presenting with today and trying to connect them with resources for that, which we might do, we're also trained to look for what might be causing this challenge or issue now, and how can we help move that person forward to overcome whatever that cause is, so that they're not caught in this consistent cycle. So we're trained to really assess people and situations and look for what might be underlying and how we can help move that person forward with that. We're trained to really work on fostering independence and being wary of things that might create dependence from people on us. So again, we're looking for that cause, what's underlying their challenges they're having. How can we help them be more independent and able to work through these things in the future? And then we do use clinical skills, even if we're not in a clinical environment. So those assessment skills, those individual people skills, we're trained at looking for the stage of change somebody's in. So we used to talk about being in denial versus being ready for change. And stages of change really speaks to that some people aren't quite in a place where they're ready to access services for something yet, but we can help move them towards that. And then motivational interviewing and kind of brief interventions that are perfect for library settings. So that's why a lot of libraries are going with social work collaborations in some way. Samples of activities that we see in libraries from social workers. So micro level services are things like working with individual patrons, assisting with information, making referrals, doing that and holding, helping people actually follow through with referrals, doing crisis intervention, some case management, or individual level advocacy are all examples of those micro level skills that happen in libraries. Meso level skills are the in-between. They're the group skills that social workers are trained to do. So we're trained to work with groups of people, and in a library that looks like you could have a social worker facilitating some sort of programming for patrons on like mental health 101. But helping people understand what signs and symptoms are of common mental health problems, and then what do they do and where can they go, who can they call if they think they or a loved one has a mental health problem. So you see social workers doing programming in libraries that are on psychosocial needs. Sometimes library social workers are also facilitating or bringing together non-clinical mutual aid or support groups, but bringing together groups of patrons that are all, trying to address the same issue. They might also facilitate book groups that are on books related to these psychosocial needs, or they might do staff training to help increase the staff capacity of addressing these kinds of patron needs. And then macro level services that social workers are doing in libraries include things at the organizational or the community level, such as needs assessments, community needs assessments in the library, participating or bringing together work groups or task forces to address some of the needs that are coming up, looking for funding sources or working collaboratively with other organizations in the community to address some of the gaps and figure out long-term solutions, analyzing policies in the library to really look at which ones might disproportionately impact one group of patrons over another, but things like that. So those are examples of things that social workers are doing in public libraries. There are a variety of different models of collaborations that we see, and a variety of models that we see of libraries trying to address these kinds of patron needs. So on the far left side of this arrow, you see this is when libraries don't collaborate with a social worker, but instead they really try to develop their in-house staff, and they might train a librarian or a specific staff member to be the person who really focuses on building relationships with community partners, maintaining resource lists, maybe developing some kind of card of resources that they can hand out to patrons, but it's all done by library staff in this kind of model. Moving along the arrow, we also see models where libraries will partner intentionally with community partners or other community organizations to have people come into the library certain days of a week to do office hours or to do outreach with people in the library space. We also see a growing number of libraries that are using social work students. So all social work students are required to do a practicum or an internship during school. And many libraries are now hosting social work students in their space as a way to meet some of these needs, because students can do many of those things I mentioned on the micro, meso, or macro levels. And it's usually free or low cost and an easy way for a library to try social work services and see how it's working. But these are time limited projects, since the student is typically with the library only for 1 semester or 2 semesters. And then on the far right, we are seeing an increasing number of libraries who are either hiring on-site social workers for in their library or contracting with another organization to have a social worker in the library for a certain number of hours every week. So this is a map of the known existing social work and library collaborations, and the website is right there. It's called Whole Person Librarianship. This website is a good one for you to look at if you're interested in social work in the library, and some of you may have already looked at that or may be aware of that source. This map is not entirely accurate because it relies on libraries to self-report when they've added a social worker or a social work student. So it's, there have been so many that have rapidly increased even over the last year that I know aren't represented on this map. There also are a few on this map that I think don't exist anymore. So this is the best resource we have, though, to know what collaborations are happening around the country. And you can see from this map that the largest number of collaborations we see are social work students. Those are the blue dots in this map. Then the green ones are when the library has a part-time social worker coming in. The orange dots are when the library has a social worker from the community that's coming in to do office hours, just a certain number of hours per week. And then the kind of hot pink or fuchsia dots are when the library has hired a full-time social worker. So some of the benefits of having some kind of social work in the library that we're seeing so far, and be mindful with this that there's been no large scale like outcome study at this point, because many of these partnerships are very new. They also look very different depending on the community, so there hasn't been any kind of standard evaluation of them. But what we see from preliminary data is we see increased support for staff wellness, so staff seem to benefit from having a social worker in the space. We see a reduction in security interactions or calls to police or for emergency assistance. We see a reduction in the number of patrons who wind up being barred or banned from a library. We see an increase in patrons who now have access to community services for their needs and were otherwise sort of falling through the cracks before then. We also see the development of programming in these libraries that really addresses the specific psychosocial needs of the local community. And we see increased collaborations between the library and other social service organizations. So whatever social worker is really collaborating directly with the library can build those networks and collaborations with other providers around that community. Some of the barriers that we see with social work in the library, or some of the challenges that people have to know before they go into these kinds of partnerships, are funding is the biggest one. So funding is one of the biggest challenges. Many libraries are relying on grants, and then when those grants end, sustainability is an issue. Many libraries are getting around that by trying to contract with an existing social service organization in their community to just have somebody from that organization come sit in the library space for certain days or certain hours, and that usually is a pretty sustainable model because that organization is already receiving funding to address the kinds of needs that that person would be addressing in the library space. And then we also see libraries that are trying to fund social work positions or social work, contracted positions through library general funding or using existing resources. And some libraries are doing needs assessments to try to get more money from their city or their county to be able to add staff, but some are replacing librarian positions or other positions with a social worker. So it sort of depends on their priorities and what, like the prevalence of the needs that they're experiencing there. One of the other challenges that we're seeing is liability insurance, and trying to, it takes some time for the library to navigate if they're going to have a social worker in the space. Does their current policy sort of cover that person's work? Is there some additional kind of insurance that's needed? Record keeping is a challenge. So when I talked earlier about the overlapping values and how both professions value confidentiality and privacy, but on the social work side, because we try to help move people forwards goals, and part of our work is about helping them overcome challenges, we are required to keep some minimal records about our work with those individuals and where we might be referring them and what kinds of things are happening. And that has been a challenge that has to be worked out before having a social worker in that space, or at the beginning of the time before a social worker actually starts working with individual patrons. Just figuring out how that record keeping is going to happen. What are the minimal types of information that have to be collected? Where can they be maintained in a really safe, secure way? And that is difficult for libraries that typically do not maintain any private or confidential information about their patrons. One of the other challenges is that every library is different. So there are some similarities between the positions sometimes when you're looking at one social worker versus another in a library, but every position is a little bit different based on that library's needs, the patron population, whether there are community resources or not. So in rural communities, where there really are few community resources, many times the social worker is doing much more intensive kind of work in the library than in a community that's more rural, where that person's role might be just connecting people primarily to existing resources that are already there. Supervision and connection to others is a challenge. So if the person is the only social worker in the library, that can be a challenge, and they have to find connections with other library social workers around the country. And there are some developing networks of library social workers right now. But it's also really important that they feel connected to your staff in the library, and that they're not treated as if they're just a community partner using the space, but that they really are integrated into the staff and the team. And then staff readiness or culture shift is a challenge that comes up in some libraries. So it's important that all the staff are on board with the move in this direction. I mentioned earlier that there's a lot of conflict sometimes in libraries about what the role of the library should be. And so it's important to address those things internally and make sure that there's buy-in across your staff before going in this direction of trying to either hire or contract or have a social worker in your space, because it does result in a little bit of a culture shift too for the library. So some examples I want to mention. Many times people think, when they hear library social worker, they think of some of the first libraries that added social workers on their staff. And those were very large urban libraries in very unique urban areas. So San Francisco was the first one to add a social worker. They have a whole team now at this point, and they address primarily homelessness because of San Francisco and the needs that are in the general population there. Denver followed right after, very similar. There's now a whole team of social workers there, and they primarily focus on housing and homelessness because of the needs there in Denver. And then DC followed. So sometimes people look at these libraries and they think, well, of course they could hire a social worker and they needed it there and they had the money because of the budget there, but that wouldn't work in a smaller area. There are a growing number of smaller, still urban libraries or suburban libraries, and then there are some rural libraries that have now added social workers. And in these examples, the social workers are really doing all of those micro to macro kinds of activities I mentioned. So they might meet with individual patrons, but they're also working on some community level things and organizational level initiatives as well. So some smaller areas that have added social workers, many of these are collaborations, and they're not a full-time social worker in the library all the time. The first example here on this slide is Burbank Public Library in California. This is a population of about 103,000. They developed just last year a shared social work position that's shared between the library and the Parks and Rec department in that city. And they share this full-time position between 3 libraries and 2 senior centers. And she really rotates between all 5, making sure that people know about resources and they're connected to whatever they need in the community. She also works to really establish and expand community partnerships between the library and other organizations, because she obviously can't do everything herself when she's working with 5 different organizations, but she can build connections to help that library and those 3 libraries really move forward into the future. Georgetown Public Library is a population of about 71,000. They had a grant-funded full-time social worker whose job was, again, to work at the micro level with patrons, but also to work at that community level. And he really served as a liaison between the city and the library and helped to develop and expand community collaborations. They actually lost their grant funding last year, and they don't have a social worker in that particular library anymore, but now the Texas State Library Commission hired him at the statewide level, and that's actually the first state to hire a social worker at that level. And his job is really to provide resources and assistance and training for libraries around the state of Texas now. Rochester Public Library in Minnesota is another collaborative position. So this is a partnership that developed just last year between the library and a community organization that's a nonprofit in that community. And the social worker is hired by that community organization, but she spends 25 hours a week in the library working out of what they call their wellness corner to work with patrons and connect them to resources. And then rural libraries. The very first rural library to add a full-time social worker is the Niles Public Library in Michigan. This is an area with a population of under 12,000 people. This was a grant. That was a 3-year grant. They actually just lost the grant, and she is no longer in that role. They don't have a social worker anymore. But she did a lot to help other rural libraries look at this model and learn about what social work could look like in a rural library. And she also supervised a group of interns to meet with individual patrons and connect them to services, as well as trying to address gaps in services in that community. And then Union County, South Carolina got around the sustainability issue that Niles experienced with the grant by actually making their assistant director position in the library a social worker position. So in that library, that's a very rural community of under 8,000 people. There are very few other partners in that community, in that county, other churches that try to address some of the needs. But she is the assistant director in that library, so she has all normal, typical administrative responsibilities in the library. But about half of her time is also spent with an actual caseload of patrons that she works with to try to help them address whatever their needs are and connect them with resources when possible. She also works with all of the other organizations in that county to address some of the gaps that exist there and to see what the library can help with. So for example, there wasn't a food pantry at all in that community. So she developed a food pantry that operates out of the library space, just because that wasn't duplicating anything. They just didn't have it there. So those are some examples. The other thing that keeps popping up, or as I mentioned earlier with the map especially, are increases in the number of social work students that are hosted by a library for their practicum. And this is frequently the first step for a library that's considering social services if there's a social work nearby. The benefits of this is that it's inexpensive. It usually doesn't cost anything unless the library is trying to pay the intern in some way or has to pay for supervision in some way. And students can do many of those micro to macro activities I mentioned earlier, although you have to understand that you're not going to get exactly the same quality of services from somebody who's still learning as you would from a professional who's a little more seasoned. Challenges with students are that there's frequent turnover. It takes a while for them to get oriented to the library, and then they're only there for 1 semester or 2 semesters. There can be gaps between placements. Sometimes universities don't have somebody that's appropriate for a library placement every semester, or they may not place year round. Students can't operate independently, so somebody who's a social worker has to be supervising them, and that can be a challenge sometimes. Many social work programs also have some specializations that might not be a good fit for a library placement, although remember that all social work programs, at least part of that program, has to be focused on these generalist placements. So a generalist placement would still be good for a library. And many libraries aren't close to a social work program. There are some growing networks of libraries that are trying to support social work students. So one of the most well-known right now is in Allegheny County, Pennsylvania, which is a partnership between 46 public libraries around that area who have 70 different locations. And these libraries all operate independently, but they've formed this coalition where they look for grants together and they really try to share resources between one another to magnify what one library would normally be able to do. And they got a grant recently to be able to do paid internships for students and to pay for the supervision for students. And now they have a big network of social work students that kind of rotate between these libraries. There also has been, so I didn't put it on the slide, but there's been a lot of conversation in Kentucky with the assistance of KDLA to bring together the various schools of social work around the state of Kentucky and interested public libraries to try to pilot social work students in a select number of libraries learn from those pilot placements, and then expand in future years. So I know Hillary has been working with that, and then Amy, who's also on this in this meeting, have worked to organize that group and really figure out what this will look like moving forward in Kentucky. So there is a movement in the state right now to try to get social work students in libraries. So we've got about 10 minutes left. There is time for questions. I've also got my information here, and I'll send, I don't know, Hillary, if you can send out, oh, okay, you've got the information in the chat. If you want to know more, feel free to contact me, or if you have questions that you don't want to answer or ask today, feel free to contact me at either my UNC Charlotte position or Beth Waller Consulting. You also might be interested in looking at the Whole Person Librarianship website, or there's a separate website that's about social work students in public libraries. So those are some good resources for you. And then Hillary, I'll send my slides to you too. My other references are on here. So if you can't, I don't know if you're able to send those, but if you can send those to participants, they can have those as well.
I sure will. And actually, thank you for bringing that up, Beth, because these slides are available for you in your Blackboard Learn in the PDF and slides section of the course. So you can log in there today and download those at your leisure. But certainly if you have questions and so forth, I'd be happy to send those to you as well. It sounds like Beth's okay with that. So
yes.
And folks, please feel free to type in the chat any kind of questions you have. As Beth said, if you don't feel comfortable asking something here live today, you can email her. If you want to email me, I've put my email in chat and I will forward it to Beth too. So, but any kind of questions you have, certainly welcome. I think it was really great, Beth, that you shared some of the examples of libraries that have had this but had to stop having the program because of grants. Just it's great to know some of the barriers that have existed for folks who have wanted to do this, but also ways to possibly get around that.
Yeah, it is a challenge. Funding is the biggest challenge, of course, because so many libraries have already had budgets cut and they're trying to do more with less. And it seems like more and more communities are expecting, libraries to just keep doing more without the financial resources. So there have been quite a few libraries that have started these kinds of services through grants, but then have struggled to make them sustainable. So needs assessments are helpful, and sometimes people will have, so if they do have a grant funded social work position, part of what that person will do is continue to collect data on what they're seeing and who they're, what kinds of services they're providing that then can be used to justify to city administrators or county administrators or to a board the need for increased funding. So that has been successful to help some libraries with that issue. And then I mentioned that some libraries have decided to convert other kinds of positions once they're vacated to a social worker position. But the funding piece is definitely a challenge for sustainability.
I'm not seeing any questions in the chat, but please don't hesitate to do that. I'm going to drop in the chat a survey that please want to request that you fill out to let us know your thoughts about this session today. So appreciative of Beth for presenting this and for offering her time and her talents and resources, her knowledge to present this today. Very informative, very appreciative of that too. I also, if it's okay, Beth, I'm going to share another slide, if that's okay.
Sure.
Okay, I'm going to switch slides and share to thank our Institute Museum and Library Services for sponsoring this webinar. They provide funds to allow us to put this webinar on, so thank you for that. I see a comment in the chat. Thank you, Athena, for being here today. Well, I'll stay around a little bit longer, and if you've got questions, you're welcome to type those in the chat, or have any comments, you're welcome to do that too. We've got the time until I believe noon, so if that's okay, Beth, I'll just hang out here too.
Sure.